The pandemic is no doubt taking a toll on everyone's mental health, but experts are sounding the alarm over an increased rate of depression and suicide among Black youth.
New data from California's Department of Public Health shows the suicide rate of Black youth has doubled since 2014. And in 2020, 12 out of every 100,000 Black 18 to 24-year-olds died by suicide.
Those numbers are alarming. The U.S. Surgeon General has also warned about the increased risk of depression, anxiety, and stress. A December health advisory notes that during the pandemic, Black youths were more likely than others to lose a parent or caregiver to COVID-19.
Joining us now is Dr. Amanda Calhoun. She is an adult and child-adolescent psychiatry resident at the Child Study Center in the Yale School of Medicine.
Doctor, I just want to start off. Thank you for joining us during this time. I mean, we're fresh off of a few stories that have made the news in reference to depression, suicide, et cetera. But when you look at children specifically, what are they coming to you with? What are you seeing in terms of the issues? And how do they vary based on a child being Black?
Well, thank you both so much for having me. I'm just very grateful to have this platform to talk about this issue. It's been a problem for a long, long time that Black children and Black adolescents have frankly not had adequate mental health care. When you talk about access to mental health care for Black children and adolescents, there's a huge problem in access. We know that Black families have less generational wealth than white families because of years and years and years of racism and intentional economic oppression. And because of that, Black children and adolescents, frankly, have less access to seeing a psychiatrist like me to begin with. And then I'm also very interested in once Black children and adolescents do finally make it to a child and adolescent psychiatrist or a social worker or a psychologist, how are they treated? How are they treated in the mental health system? When you talk about what are the types of issues that Black children come to me with, well, unfortunately, Black children are forced to know that they're Black at a very young age. And while I'm happy to be Black myself, they're forced to know that they're Black and think about race because of the racism they experience at a young age. And Black children want to talk to me about that. Black families want to talk to me about how do I navigate the racism that my Black child is experiencing in a predominantly white private school? How do I navigate the racism that my child is watching on the TV when we're seeing Black children and teenagers brutalized by the police? They're hungry to talk about those issues, but frankly, most of them don't even get a chance to see a psychiatrist like me. And when they do, frankly, psychiatrists aren't trained to be able to help Black children navigate the issues of racism and their identity.
Boy, it sounds like doctors like you are so badly in need. We need to replicate you and send you to sort of every school in America, it sounds like. But Dr. Calhoun, I also want to talk about the fact that we've mentioned that, Black families are more likely to have been hit really hard by COVID, children to lose a parent or caregiver. So is there anything that has surprised you about how children have reacted to death or illness within their families?
Wow. I would say what continues to surprise me is the resilience of Black children and adolescents, and not just the children themselves, but their families. I've seen families where, great grandmothers have had to step in as caretakers because the primary caretaker, the mother or the grandmother who is taking care of them, passed away. I've seen instances in which families have come together to really protect their children. And so I've been so surprised, I guess, pleasantly surprised, but also sad that, Black children and adolescents are being so disproportionately hit by this pandemic. And the fact that we really still aren't talking about that. I think we're starting to talk about it, but it's sort of a hush topic. Even in psychiatry, we talk about it, but we don't really delve into it and start talking about, well, why are Black children and families hit disproportionately? Why are they poor? And it's because of years of racism. And how do we help them to recover from this pandemic? And what are teachers, psychiatrists, psychologists, how can we support Black children and adolescents from this pandemic? Because while we are all suffering from the pandemic, people of all colors, at the same time, there are disproportionate effects on the Black community. And how do we honor that and help support them? And so I think we need to talk about it more.
And when you say that there's racism, that a child knows early on, okay, I can't hide this, I'm a black person, and I keep seeing people on the news and in different media spaces where we're not always viewed in a positive light. So knowing that, and you say we have to have these conversations, and the question is, how do you navigate that? How do you? What are some of the steps? What are some of the tools that you're telling children and their parents as they go into this world so that they can better be equipped with how to handle this and how to handle those feelings of depression or isolation, or that they're not good enough?
That's such a great question. You know, a recent study came out that showed that Black teenagers were reporting multiple racist incidents in their schools every single day. And so I'm a big proponent of being direct with kids. And, you know, I have direct conversations with kids as young as 5 about these conversations because kids know. They know that they're being treated differently because of the color of their skin. And so what I recommend is talking to kids directly. So I start with positive validation first. And I actually, you know, give a lot of compliments. And I say, wow, you know, let's talk about different skin colors. And your skin is so beautiful. It's brown, and your eyes are beautiful. They're brown. You know, I often do a lot of coloring with my younger kids, and I'll specifically choose different shades of brown and say, I'm gonna, you know, draw this character, and I'm going to make them brown with brown hair and brown eyes. And I often have had many Black children look at me and kind of say, huh? You know, why are you going to do that? Because oftentimes, you know, they don't see themselves elevated as beautiful or as preferable. And I say, because I love brown skin. And so I start with validation, and then I go into the tough questions, and I really cut right to the chase. Have you ever been treated unfairly because of your skin color? I mean, I have kids who are being called the N-word in schools. You know, this is really real, and this is hitting these kids hard. And so I really try to give them a lot of encouragement and validation for being proud of the skin that they're in, and also to normalize the fact that it's okay to feel sad because of what you're experiencing. And it's okay to reach out to someone else for help. You don't have to do it by yourself. Families don't have to do it by themselves. There are people like me in the mental health system. There are amazing teachers. There's always someone that you can lean on who can help you. You don't have to do it alone.
All right. Dr. Amanda Calhoun, thank you so much for joining us. We so appreciate your insight.